Good afternoon, Miss Buck. Thank you for agreeing to meet with me.
Of course. I was a little nervous to get your call. Is everything okay with Robbie?
Yes, everything's going really well, actually. He has really started to open up during our sessions. I'd just like to make a point to check in with parents and go over the progress we've made so far.
That's a relief. I thought maybe he had had another bad outburst or something. I know he tends to have a quick temper.
No, nothing serious. Have you been having issues with his temper at home?
We've had a little trouble with him, I guess, but not any more than usual. He just gets so worked up sometimes, and it seems like nothing I do or say can calm him down.
What typically happens before Robbie has one of these outbursts?
It usually just starts with me talking to him or asking him to do something. It's like he tunes me out and I have to ask him a million times before I can get a response out of him. It has really started to test my patience, and as soon as I show any signs of agitation, it just makes things worse. That's when he typically starts acting out.
Are these similar to the situations his teacher told you about?
I know his teacher had a few problems with his temper, but she said the majority of the issues she has had with Robbie were behavioral. He frequently talks without being called on, and is a distraction to the class.
And what does Robbie say about it?
His excuse is usually that he's bored or couldn't help it.
And you don't believe him?
I just don't understand how he could be so bored in class. He seems so enthusiastic about going to school and learning, if only he could just follow directions.
I agree that Robbie is a very enthusiastic and creative kid, but that actually leads me to one of the things I wanted to talk to you about today. I think it could potentially be beneficial to Robbie if you had him tested for ADHD.
ADHD? What do you mean? You think there's something wrong with him?
I'm not suggesting that there's anything wrong with him. There are millions of kids that are diagnosed with ADHD, especially young boys.
How could Robbie have ADHD? I thought ADHD was when kids were just incapable of sitting still. Most of Robbie's issues are behavioral.
Hyperactivity is a symptom of ADHD, and there can be more to it than that, and it can present itself differently in each child.
And what makes you think he has it?
It is common for children with ADHD to interrupt or blurt out answers in class. They can also be impulsive and act without thinking, which can be perceived as disrespectful or disruptive by others.
I mean, I guess that might explain some of his problems in class, but that doesn't explain his temper or outbursts.
Well, if Robbie's feeling misunderstood or even embarrassed by the teacher in class, he might not know how else to deal with the emotions. I truly believe he wants to do the right thing and please you and his teacher, but there is just so much going on in his brain, he can't fully grasp why he's struggling.
In his brain? What do you mean there's a lot going on in his brain?
Well, while the cause of ADHD is still unknown, there is research that suggests that it is a neurological component to it. I know that might sound a little scary, but all it means is that Robbie's brain acts a little differently.
Differently how?
Well, research has shown that ADHD has an impact on the frontal lobe and cerebellum of the brain. They are not threatening differences, but those areas of the brain are related to concentration, impulse control, and motor activity. This might explain some of Robbie's struggles and why he's frustrated in class.
Is there more we can be doing at home to help him?
Usually when a child has ADHD, it's hard for them to hear exactly what you're saying. For example, if you tell him to clean his room or pick up his clothes, he may not hear you right away. Sit him down and make sure that you have his full attention before asking him to do something. Try keeping as calm as possible, and if it doesn't work the first time, come back and approach the situation with a positive attitude, and he'll be more likely to respond. It's important that Robbie isn't made to feel as though it's his fault and he's acting this that It's important that Robbie isn't made to feel as though it's his fault and that he's acting this way. He doesn't purposely ignore you, although it may seem that way. It's important that you remember this when trying to talk to him.
I try to stay positive as I possibly can, but it's so hard when I have to tell him over and over again to do something. And then, of course, he acts up and starts yelling. Maybe I should approach him with a different attitude, though. I'm just not sure how to get through to him.
Maybe it would be beneficial for him to start a daily routine. A child with ADHD has an easier time sticking to a structured routine, making it easier for them to finish the tasks that you're asking them to do.
I've tried to tell him that right when he gets home, he has to do his homework and chores, but then when it comes time to do it, he acts up and tunes me out when I'm trying to speak to him and goes right to his video games.
I think that what would make it easier for him would be to have a reward for doing his homework and chores. If you tell him that once his chores and homework are done, then he can play his video games, he'd have more of an incentive to get his homework and chores done first. Children with ADHD work better when there is an award that they will get afterwards. Also, make sure to tell him that he did a good job. Praising goes a long way.
Okay, hopefully this will work. I'm just tired of arguing with him all the time.
I know it can seem like a handful at times, but try to look at the positive personality traits that Robbie brings to the table as well. Bringing attention to his strengths will help him feel like less of an annoyance, and may keep him from acting out so much.
Right. Like I said, he is very driven and enthusiastic.
Exactly, those are great qualities. A lot of children with ADHD show strengths creatively and intellectually. Robbie may not recognize that those are strengths though, so make sure he doesn't get too down on himself after a tough day at school.
Are there other techniques I can recommend to his teacher to help him perform better in class?
Remind her to use patience and a positive attitude when working with him. A creative approach to learning can be helpful to him, making it easier for him to focus on the assignment. Visuals are really important.
What if he gets overwhelmed and starts acting out?
Have her and Robbie come up with a discreet warning sign that she can use if she feels he is starting to become disruptive. And make sure that if she needs to talk to him about his behavior, she does so in a private way, away from the other kids.
She had recommended working with a school counselor to come up with a specialized plan for him. Do you think that's something he needs?
It could definitely be beneficial. School counselors are great at working with teachers to come up with classroom accommodations for students that may need some extra help. For example, moving the seats away from the window and creating a learning space for him that is free from distractions.
Okay, I can see how that might be helpful, but what happens if that's not enough? I don't want him getting into any significant trouble at school.
Medication's always another option. I know that can seem a little drastic, but it can help calm a lot of the symptoms of ADHD and help keep Robbie's mind more focused.
Medication? Yeah, I don't know about that.
It's just an option. Stimulants can work in the area of Robbie's brain that are affected and help enhance their activity, allowing him to gain some more control of his thoughts and behaviors.
What about all of the side effects, though?
Medications affect each child differently when it comes to side effects. There are several different options. It's just about finding the right fit for Robbie. I know it seems like a big decision, but just consider it. In the long run, it may be more beneficial to him than trying to constantly make environmental accommodations.
I guess that makes sense. I just don't like the idea of him being medicated for the rest of his life.
It wouldn't necessarily be for the rest of his life. Medication is something that would be monitored and adjusted as needed as Robbie ages and matures.
Okay, that makes me feel a little better, I guess. I'm just not ready to make that decision right now, though.
Of course, I encourage you to take your time and weigh all your options, but like I said, just starting to have him tested is a good first step. And remember, it's important for you to take the time for yourself as well. Do the things that make you happy.
Thank you so much for taking the time to talk to me today. It's been really helpful, and I will definitely look into getting Robbie tested for ADHD.